interesting.
Yeah.
Good to go? Great. Well, it's wonderful to be here in Nambour this morning with our local member, Rob Skelton, and we've just been visiting the Nambour Hospital looking at the works that are under construction right now and what's already been completed. But before I talk a bit more about that, I do want to just give a COVID update today. We've had 6,682 new cases reported. 5,747 of those are self-reported through rapid antigen tests, and I thank the community for continuing to test and for updating their results on our register so we can have a better idea of the number of cases out there in the community. The number of reported cases at the moment active is 49,359. We also have an additional 141 new influenza cases reported overnight. I'm pleased to say that there's no deaths reported at this stage, but we do often see a lag in reporting over the weekend, so we'll update those during the week. But our COVID numbers in our hospitals, we have 815 public hospital patients with COVID right now. 16 of those are in ICU, and we have another 99 in private hospital beds, with 2 in ICU, and another 53 influenza patients in our hospitals. So we currently have 967 hospital beds being taken up with either COVID patients or influenza patients, which we know puts a lot of strain on our hospital system. Those sort of numbers are equivalent of 1.5 times the Sunshine Coast University Hospital just dealing with COVID and flu patients. I also have another 2,477 staff who are off with COVID, but we know those numbers are much larger when we include all of the staff that we have off with sickness at the moment. On average, we have about 3% of our staff that would be sick on leave, but we are averaging between 6 and 7%. Now, when you look at the beds being taken up with COVID and the reduced staffing, you get an idea of the pressures being faced across our hospital systems at the moment. So we'll continue to manage those demands across our health systems as we have been. The Premier noted on the weekend that out of National Cabinet there is a recommendation that people consider wearing masks indoor, particularly where they are in heavily density areas. So where there's lots and lots of people, then we strongly recommend you do put your mask on, which means when you're going back into busy supermarkets and you're at big shopping centres and that, look, it's just a sensible thing right now with an increasing rate of COVID cases to put those masks on. Of course, they're still mandatory. If you're going into health settings, aged care, disability hospitals, you must have a mask on. But in other settings, we do recommend people just take that sensible approach, carry a mask with them and put them on indoors. Of course, you can take them off while you're seated and, of course, if you're eating and drinking. But it's really just about taking a really sensible approach that we know works. I also want to re-emphasise, stay home if you are unwell. Whether you have a positive or negative rapid antigen test, if you have symptoms, you should stay home. If it's not COVID, it very well could be influenza, and you will be spreading it to your friends, to your families, your loved ones and your work colleagues. And that also impacts on our economy and business when so many people are off unwell. So you can do your bit to reduce the spread of viruses around the community right now by not going to work and staying home when you are unwell. Now, a bit more about why I'm here today. $86.2 million that the Palaszczuk government has committed to redeveloping this wonderful hospital at Nambour. The Nambour Hospital has been serving this community since the 1920s and will go on for many, many years to come to service this community. We want this local area to know that for emergency care, for renal dialysis, mental health, low acuity care, including surgical care, that they can come to Nambour Hospital and not need to go to our larger ones like the Sunshine Coast University Hospital. That helps with taking taking pressure off our larger hospitals, but it also means having facilities right here in the local community. Now, doing a major redevelopment on an existing fully operational hospital is not easy, and that is why this project is being done over 4 stages to reduce the impact on patients and also the staff as all these redevelopments occur. So that means that the completion of the 4 stages are due in late 2023, but already we have seen the completion of the renal dialysis unit, which I've just gone and walked through with Rob this morning. It was originally planned for 8 chairs. They've actually built it for 12, which means they've got extra capacity here and are able to deal with that growth, in which there is going to be significant growth in this region between now and 2031. I think about 26% growth expected by 2031. And that's why we're putting in record investment into our hospital and health services to ensure that we have that bed capacity going forward. Currently, the Nambour Hospital has 137 beds. It's going to have a built capacity of 255 beds when this construction is completed. They also already have a new medical imaging area, mental health unit. They've got interim new spaces at the moment, including an ED. The building right next to us is going to be torn down very, very soon. In a matter of days and weeks, they'll start tearing down this building to build a brand new emergency department. So that's really exciting that we are going to have the expanded emergency department, extra beds, mental health beds, of course the new renal dialysis unit that is already supporting this community. I do want to thank all of the tradies and construction workers. I know this is supporting jobs as well, but we know how difficult it is and we know how much collaboration needs to happen between our tradies and the hospital staff when you're trying to manage around a fully functioning hospital, especially with COVID around and the extra overlay of PPE and the requirements for safety and reducing the risk of spread of the viruses as well. I might leave it there and get Rob to say a few words about our investment, and then happy to take some questions. Thanks, Rob.
Obviously, I'm very pleased to have the Minister here and announcing this investment in the Nambour General Hospital. As the Minister said, we are expecting a lot of growth. It's always been here and been a dependable icon of our community, not only for the community itself, but also employs so many health professionals. It's been a hub. It's been a hub for this community for such a long time, and really did need an upgrade. And I'm very pleased that we now have one, and we can move forward into the future. Thank you.
Well, we know that what happens in our communities and in our hospitals creates the pressure for our ambulances and our paramedics because we talk about bed block, and bed block is about how do we get people out of hospital beds and back into their homes, back into the community or into aged care or disability support so that we can make way for people coming in. On any given day, we have around 300 people coming into our EDs. About 30% of those actually need admission. When you think about that, when you think about 30% of people arriving at EDs, either walk-in or ambulance, need a hospital bed, and you've got people coming in for elective surgery as well, that bed demand is incredible. Now, we also know that people are struggling to get into GPs. Areas like Nambour here and Bly, Palmwoods, all these areas, it's very hard to get into a GP. If you can't see a GP because their books are full, that you've got to wait days or weeks, or it's not affordable because not all will bulk bill, then you turn to our hospital system and you turn to our ED. So all of that's putting pressure on, and that's why when we invest, we're not just investing in our Queensland ambulance service and more stations, more ambulances and more paramedics. Where we're investing is more hospitals, more expansion of hospitals and more beds, but also innovative ways of supporting the people in the community so they never have to come into our hospitals. Again, we'll take the advice of the Chief Health Officer and the health professionals. At this stage, it is not being recommended. We encourage it, and I believe the ECHA might have said a few words yesterday just saying that they may be handing out masks. I support that move by the organisers of the ECHA to actually have free masks available for people as they're arriving. We did the same thing at the State of Origin. Queensland Health made sure there were free masks at all of the entrances so that anyone who wanted them could have them. Most of the ECHA is outdoors, but we do know, I've been to the ECHA plenty of times, it can get awfully congested. You get into Sideshow Alley and it can get pretty squished in there on busy days, including People's Day. So it's just sensible to carry a mask with you and put a mask on, especially as you're wandering around the pavilions. Sure. So it's certainly, as far as a statewide or a national decision around any restrictions on aged care, that really has to be driven by the Commonwealth. Of course, it may require state health directives to implement those decisions, but it is a decision of the Commonwealth. I spoke with health ministers yesterday. There isn't any proposal coming out of the Commonwealth at this stage around further restrictions on aged care, but I know they're working really closely with the private aged care facilities. We will always provide and support for aged care. So every day, private aged care facilities are reaching out to the Queensland public health system. We will provide PPE if they need PPE, a short notice. Other equipment, we've provided them stock like syringes and so forth. We've done this throughout whole of COVID. We'll continue to do that. We often escalate things to the Commonwealth regulatory body on behalf of the aged care, saying here's a particular aged care facility that's in crisis, that does not have enough staff because they're off ill with COVID and they've got a major outbreak. Someone needs to step in and support them. So we'll continue to support them, but it really is, the Commonwealth's role. And I understand individual aged care facilities also will make decisions around whether they restrict visitors, whether they mandate masks. They have the prerogative to do all that within that facility if they have a major outbreak. Oh, look, I saw those stories this morning, and I saw Minister Annastacia Wells saying that they would look at all options necessary. I completely understand aged care facilities being concerned around loss of staff due to illness. The fact is that the vulnerability of those residents is already high, but if you cannot have a reasonable or a safe staff to patient ratio, let alone nurse to patient ratio, we know we'd prefer that, but staff to patient ratio, if you cannot maintain those ratios in a safe way, then someone's got to step in and manage and look after those residents. We heard some awful stories earlier in the year where residents were being locked in their rooms, that they weren't getting any time to see people. The food was inadequate because there was no staff there providing proper meals. So I hope we don't see that again. And if the ADF, if that's what the aged care facilities want and that's what the Commonwealth are willing to provide, then it should be done. Yeah. Yeah, look, we're doing everything we can around mitigation. Everyone knows what to do. We've been living with COVID for 2.5 years now. We know what the mitigation measures are. Stay home if you're unwell. Wear a mask if you go out and you're indoors and you're particularly vulnerable. Make sure you get your vaccination. We know 2 jabs are not enough. That was fine in 2021 with Delta. It is not adequate with Omicron. Too many people are dying who have not been fully vaccinated. And we heard, just the other week, the first 10 people that passed away from COVID from the most recent subvariant of BA5, 8 of those were not fully vaccinated. So that is a great mitigation measure that is free, that it's readily available. There is no reason for people to be not vaccinating. I do ask people, your sanitisers, businesses, If you've got your sanitisers there, make sure they're actually full and they're working. People, start sanitising when you're going into shopping centres, putting your hands all over handrails, pressing buttons again and doing everything else, shaking hands. Use sanitisers again. These are really simple measures that people can take. My message to doctors is the same message to all of our health workers. First and foremost, thank you for the incredible work, the sacrifices you are making. I know you're tired, I know you're exhausted, you're fatigued. I know they need a break. I know the pressures are endless at the moment. We are in another wave that will see us go beyond the peak of the first wave. We are not at the top of this peak. We still have some time to go. So those pressures are going to get worse. I ask people that if you can see a GP, instead of coming to an ED, if it's not an emergency, do so, please. You know, ring 000 when it is an emergency. Be mindful of our frontline service workers, our health workers, our emergency services, and make sure that you're using it in a sensible way when you really need it. So those most in need can get that access. But we are doing everything we can, which is why we've got this record budget this year. We are pumping as much money and resources into our system that we possibly can to make a difference, to get more staff in, and to build our workforce, to open up bed capacity and to make sure that we can deal with these demands.
From Brisbane, on one day in March, 2 hours were lost to emergency department, 15 paramedic crews. With those stats, patients getting in.
Look, we are doing everything we can. We've set up the triage tents outside of our EDs in our major hospitals. That way we can triage and separate the COVID patients to reduce the spread and demands in the waiting rooms. Those initiatives are working really well. We've got paramedics actually stationed on those bays to help with the turnaround. We're even trialling things of the new electronic stretchers, actually changeover of stretchers. So instead of the paramedics arriving, having to wait for the patient to be offloaded, clean the stretcher down, do all that, we've actually got stretchers there that we can hand straight over and go, here's a new stretcher, we'll keep yours and you can pick yours up next time. There's all these initiatives. I know Metro North, which you just mentioned, Metro North are trialling having nurses actually walking the waiting rooms in ED. So that they can keep checking on patients and they can also reassure them as far as the times, because sometimes people feel like they're a bit forgotten. So they're using that, and we actually are trialling a virtual ward at the moment. So we actually have clinicians talking to patients who there may be a paramedic already there, who we can link them in with either outpatients or a GP so they do not have to come and be transported to an emergency department. There is a lot of good work happening out there, but there is no mistake, the demand is outstripping everything we bring in. That demand keeps increasing because of what we're seeing with particularly COVID at the moment. And I got up this morning and I saw reports around Victoria and South Australia, pressure on the health systems. We're all dealing with it, and that's why I'm really pleased that every state and territory health minister, including the new Commonwealth health minister, are committed to working together to deal with these pressures. It'd be close to 2 weeks now. Yeah, so same thing. We've got, we just have exhausted all avenues of trying to find locums. We have staff off sick. We get this any given day. This is why, and the pressure on the doctors, when surgery is cancelled, the doctors feel that as well. When a doctor who is due to do important surgery that day wakes up feeling unwell, takes the tests and find out they're positive, they can't walk into this hospital. They can't walk into that operating theatre and they can't do that surgery that day. That impacts on people's lives. It also impacts on the health and well-being of our doctors who feel so deeply about having to make those tough decisions. So, you know, we have these problems happening across the system. Gladstone's not unique. We are doing everything we can, including reaching out to other hospital and health services to see if we can get other obstetricians to come in from our other hospitals to help with those pressures. But right now, we are struggling to find replacements there, which is why we have notified every mother who is due to give birth about the alternate arrangements. So we have put in place alternate arrangements. I hope we can resolve this soon, but these are pressures that we're all facing across the health system at the moment. Yes, so some are in Tier 3. That means that they are making decisions, that they are suspending some of the lower level surgeries, planned care. They are doing everything possible to not suspend too many because they know that we have a backlog because of the previous 2 waves. And if we keep suspending, it's why we've made the decision not to do a statewide suspension at this point in time, because we know that all that does is put more and more pressure down the road. It just pushes it down the road, and we will have the longer and longer waiting lists. So I know our hospitals are doing an amazing job that where they can, they are doing that planned care, but there is some that they are having to reschedule just because of staff sicknesses, the number of COVID patients in ICU. Sometimes we may have a bed, we may have a surgeon and operating theatre, but if we don't have an ICU to put that person in and they are needing that ICU after surgery, they can't have that surgery. So all of those things are putting pressures on the system. They are coping as best they can with the extraordinary circumstances we all find ourselves in at the current time, both nationally and globally.
Is there a need to open more COVID wards?
Sorry?
Is there a need to open more COVID wards?
Well, each hospital decides how many COVID wards they need, and I've seen at the start of the outbreak this year some incredible work being done. I saw, units for endoscopies and colonoscopies, whole areas being turned around in 72 hours to become a temporary ICU ward. It's incredible what our hospitals are doing on the ground. So if they need to open up COVID wards, they will do that. What the community needs to understand is in doing that, it also means taking away other beds that are generally set aside for planned care, and that means more delays in planned care surgery. Yeah.
How bad is this going to get?
Yeah, look, I thank everyone who did come out and get their flu jab. The free flu shots have ended now, but we had a lot of people coming out. I remind people that 6 months to 5 years are still eligible, and 65 plus, which are, those groups that are most at risk, that the free flu jab is still available through the National Immunisation Program. I do encourage people to still go get their flu shots. We are seeing people get COVID and influenza, which is not good. But influenza A is just putting an added pressure on the system. We said we expected a bad winter. We have not seen influenza A in this state for 5 years, and even then we didn't have it at the rate that we do now. So it is combined with COVID putting pressure on our hospitals, but it's also meaning a lot of our staff are unavailable to work. Sure. Look, I don't believe that those people coming into our communities via a cruise ship is increasing the risk any more than we have thousands and thousands of tourists travelling to our wonderful state. Who wouldn't? Middle of winter, you'd come to Queensland. So they're all flooding here anyway. They're pouring in over the borders domestically and internationally. So I don't believe the cruise ship creates any more risk. In fact, to get on that cruise, you have to be vaccinated. And the cruise ships have added restrictions when there is cases that you don't see in the border community. So no, I don't believe it creates any greater risk, and the protocols that have been put in place, from what I've seen so far, the cruise lines are doing a really good job in following those protocols. Look, that is up to National Cabinet and the Commonwealth to release any modelling that they do have. I remind everyone it is just modelling. All of the experts in the world are doing their best to try to predict what happens with COVID, but no one can truly know. We thought, and the advice we were getting and the modelling we saw at the start of the year is you would expect each wave would keep having waves for months and years, but they would slowly, reduce and our immunity would build. But with these new variants and sub-variants, we're not seeing that. We're now seeing higher waves than we did before. So we don't know what's coming, but we do know what we can do to try to slow down the spread. We can never completely remove it, but we know what we can do to slow down the spread. And no matter what the modelling shows, we can all do our bit by getting vaccinated, wearing masks, sanitising and washing our hands properly, and staying home when we're unwell. 4 really simple things that we all have control over that can make a difference.
Thanks, guys. We've got to go.
Thank you, everyone.